We know that the poor and minority groups are impacted by poor health outcomes and lack of access to many routine health care services. The U.S. passed the Affordable Health Care Act, but the poor still do not have the same services provided as those with more resources. People of color are less likely to receive appropriate medications for heart ailments, bypass surgery, kidney dialysis, kidney transplants, effective medications for HIV, effective surgeries, or adequate pain medications. Historically, there have been instances of racism in healthcare research that led to deaths among black men. In 1932, the U.S. started the Tuskegee Syphilis Study, or what's known as the Tuskegee Syphilis Experiment. This was considered not only unethical, but also a malicious clinical study. It was conducted between 1932 and 1972 by the U.S. Public Health Service. The purpose of this study was to observe the natural progression of untreated syphilis in rural African American men in Alabama, under the guise of receiving free health care from the United States government. The study was conducted to understand the disease's natural history throughout time and to also determine proper treatment dosages for specific people and the best time to receive injections of those treatments. None of the men who had syphilis was told that they had the disease. Many were not given penicillin, even though the medical researchers knew they had the disease, and by 1947, penicillin had been proven to be effective in treating the disease. From a perspective of economic inequality, the U.S. has labeled the term wealth gap to explain the fact that the top 1% of the U.S. owns more wealth than the bottom 90% combined. Drawing on that concept, the U.S. also has a health gap, and that's the difference in the health care and health resources available between the healthiest people and the unhealthiest people. As the wealth gap is widening, so is the health gap. Additionally, individuals with low socioeconomic status are 2 to 5 times more likely to suffer from a diagnosable mental health disorder than those with higher socioeconomic status. Financial strain also leads to marital and parenting problems due to the financial stressors. And as we talked earlier about childhood stressors, those adverse childhood experiences, what are known as ACEs, tend to lead to negative health outcomes in adult life. Racial minorities are overrepresented in our population of people that live in poverty. Estimates from the U.S. Census Bureau suggest that 31% of Native Americans who live on reservations, 26% of African Americans, 26% of Latino Americans, and 13% of Asian and Pacific Islander Americans are living in poverty compared to 8% of whites. Poverty puts people's health at a higher risk than those with adequate resources. Low birth weights in infants has a strong association with low socioeconomic status, regardless of race. Because members of most non-white groups are more likely to be poor than whites, low birth weight is prevalent in racial minority groups. Poverty also prevents groups from improving their health by limiting quantity as well as quality of food. Eating fresh and nutritious foods, particularly fruits and vegetables, is essential to building good health. But access to the places that sell these foods, specifically supermarkets or grocery stores, is limited in low-income communities and non-white communities. One study showed that 23.5 million people in low-income communities did not have a supermarket or large grocery store within 1 mile of their homes. Most meal options in these food deserts are from fast food chains or convenience stores, which offer few options for a balanced diet. A diet that is poorly balanced can lead to health problems such as diabetes, cardiovascular disease, and obesity. The access to fresh foods is significantly challenging for African American communities. A block-by-block study of food options in Chicago found that in African American communities, the distance to a fast food restaurant was about the same as in white, Latino, and Asian communities, but the distance to a grocery store was nearly twice as far. So for African American communities, it's much easier to pick up a cheeseburger and fries from a fast food restaurant than whole grain bread and fresh fruit from a grocery store. Rural Americans face distinct problems with access to health care. Rural non-whites are often a forgotten population because the sheer numbers of non-whites in the urban centers dwarfs the non-white population in the rural communities. In the U.S., 65% of rural counties face a shortage of health care providers. Financially, rural non-white communities cannot support the needed health care providers. In addition to that, there is often a lack of healthcare education among the rural poor, and this compounds the healthcare needs.